Good evening, and thank you for taking the time to listen to me this evening. My name is Christina Olfsen, and I have been an RN for over 30 years, primarily in home health and hospice, and I have been a nurse practitioner for the past 5 years. I can honestly say that I have looked at healthcare in my community and the larger community from nearly every angle. I have been a unit clerk, a home health aide, a staffing coordinator, field nurse, case manager, administrator, director of nursing, program coordinator, assistant director of nursing, quality improvement nurse, staff educator, community liaison nurse, and most recently a family nurse practitioner in hospice and in long-term care facilities. So, in what I am euphemistically calling mid-career, I strongly believe I have hit a sweet spot in my experience level, enough to be really understanding of the dynamics and challenges of balancing resources, the regulatory requirements, as well as the transitions across the healthcare settings, and balancing that with the healthcare needs of the patient population. The forces of change really are converging, moving us from the industrial age to the information age, where whole system and relational thinking must be the norm. It is such an exciting time to be in our profession, and there is so much to do. I'll provide you with a brief overview of my doctoral project. Individually, end-of-life care, substance use disorders, and pain management are national health care challenges and priorities. Effective pain management, particularly in life-limiting illness, is an ethical obligation of healthcare providers, and individuals with active or history of substance abuse are a population known to be at high risk for suboptimal pain management. Additionally, in my experience, there is a tremendous amount of discomfort in managing pain in this population, and our current tools to address this are simply not sufficient. The goal of my doctoral project is to evaluate the literature on the subject of pain management at end of life when there is a co-occurrence of substance use disorder. I will use a systematic review process, and I believe that my synthesis and summary of the evidence in this area will provide others with a foot up to do more research in this area, help develop guidelines, and I hope to publish my results in the Journal of Hospice and Palliative Care. There are identified gaps between research and practice, and the dissemination of research to practice still takes way too long. There are gaps in regulations, reimbursement, and practice as well. We all must nurture a culture of innovation in our workplaces and community, and remind ourselves to look at old problems with new eyes. We must identify solutions that are both high quality and cost effective. We must embrace divergent viewpoints and not get stuck in the status quo or complacent. Positioned at my point in my career, I am a systems thinker. I can evaluate and address intervention strategies to work with barriers to change on individual, team, organizational, and system levels. It is my goal to consistently walk the walk, to mentor, and to model adaptive, flexible, and transformational leadership. In response to the Affordable Care Act, the Institute of Medicine in 2010 published 4 recommendations regarding how the nursing profession can meet the nation's healthcare challenges. First, nurses must practice to the full scope of their education and training. Second, there needs to be seamless academic progression and higher education levels achieved by nurses. Third, nurses must be full partners with physicians and others to redesign healthcare. Fourth, there must be an improved information infrastructure and better data collection. So, to that end, I know that I must become more politically competent. Development of political competence is no longer the purview of a few. In quantum organizations, leaders across the healthcare team must understand and impact public policy and policy making. We can assist legislators by translating the clinical picture and the healthcare needs of the community, along with developing solutions. I know that I need to be more that I need to more publicly promote excellence in end-of-life care and focus specifically on the scope of practice of the nurse practitioner in end-of-life care. Like many segments of healthcare, hospice is facing funding cuts, which of course hospice can ill afford. There are reimbursement, practice, and prescribing barriers for nurse practitioners as well in end-of-life care. Additionally, there are patient populations in skilled nursing facilities for whom hospice is not possible because of the way the system reimburses room and board. Also, while palliative care is wonderful, important care, the delivery models do not begin to touch the patient populations in need, and there is highly, highly fragmented reimbursement. Although direct patient care will always be my first love, and I will strive for excellence in all the DNP essentials, I see the next phase of my career taking me to tackle the goals of DNP Essential 5, which is engagement in policy development and commitment to political activism. Some immediate topics that come to mind are to contribute to the development of more comprehensive and current models of end-of-life care and new models for palliative care, and to spearhead efforts to ensure that nurse practitioners practice to their full scope of practice. Although I am a practitioner of evidence-based Western medicine, I also am a strong believer that health care and treatments should be pulled horizontally by patient requirements, not pushed down vertically by general policies or, for instance, drug company marketing campaigns. We need to be open to all the possibilities. A balancing act, perhaps, but we have all seen the folly of a one-size-fits-all top-down approach. Innovation in patient care must be the result of collecting, analyzing, and synthesizing available research within the context of culture, regulations, and patient rights to promote transformation and healing, and in a timely fashion. And when we identify regulations or other sacred cows as obsolete or dysfunctional, we must shake off the dust of the status quo, we must question, we must research, and we must redesign. There is a saying I go back to time after time throughout my life and career, which is based on a quote that is attributed to Buddha. The mind is everything what you think you become. The translation is, what you focus on expands. In other words, what you put your time, energy, and other resources into, for good or for bad, it will be your outcome. So a strong, persistent focus on professional mission, purpose, core values, and innovation will lead to sustainable, growing, and successful healthcare services. Thank you very much for your time.